I think telehealth was bound to happen and grow. With the whole situation that we're in right now, I think this just accelerated the growth of telehealth. We're in such crazy times right now. But for real, I think with the pandemic going on right now, I think telehealth is gonna grow tremendously in the future. Outpatient physical therapy has been operating the same way for decades now. Patients come in, they tell you their problems. You develop a plan of care with your patient. You work together a couple times a week. You get them feeling better and moving better, hopefully answering some questions and achieving the goals that you guys have set together. But now with social distancing in effect, outpatient therapy arguably has been hit the most, and clinics are scrambling to convert to telehealth. Telehealth is basically virtual PT. You're basically using video chatting to treat the patients at home. I think this transition can be rough for a lot of clinics just because of the way PT has been done for decades. It's tough for both PTs and patients to adopt this new style of treatment over the internet. I think a side effect of this pandemic is a growth and a shift of going to telehealth even after all this is over. I think as a society, we're moving more and more towards convenience. People are becoming more comfortable with using technology. We are in the era of FaceTime, Amazon deliveries, ordering food with Uber Eats or Grubhub. And just look at the company Peloton. They combined a stationary bike, which has been around for decades, with a screen and introduced classes and point systems and awards and made it into like a game. They made the whole experience of working out at home more engaging and more social, and now they have a big following. I think telehealth was bound to happen and grow, but with the whole situation that we're in right now, I think this just accelerated the growth of telehealth. So instead of going to a brick and mortar PT clinic, so now you're able to do video chat and able to see a PT in the comfort of your own home. Now you may be thinking, we're physical therapists, we're supposed to be there with our patient, using our hands and just seeing and assessing with our hands. Yeah, that's true. I think there may very well be some potential downsides to doing telehealth, but I think they're not as big as you would think. First of all, not being able to palpate. As PTs, we're used to assessing movement and using our hands to figure out the anatomy and figuring out what's going on with the patient. And obviously using video chat, you're not able to touch the patient, so palpation is out of the question. But at the same time, I feel like through video chatting, you can teach the patient how to palpate and just ask for feedback and just be like, oh, touch here, how does that feel? What happens when you do that? What happens when you do this? So you can kind of teach the patient and walk through and even demonstrate to the patient how to touch and how to assess, so in a way patients can assess themselves. I think another criticism that comes to mind is not being able to do manual therapy. Without a doubt, manual therapy provides some type of symptom relief with patients. This is seen time and time again in practice, but generally speaking, PTs I think value manual therapy more than the way the evidence is showing. But I'd argue that instead of doing manual therapy, we can teach patients to self-manage. You can teach them self-massage techniques or some range of motion exercises, which can achieve the same result of symptom relief. And even more importantly, instead of relying on your hands, by showing them what they can do themselves, can improve self-efficacy. It can empower the patient to take care of their own health and be more in control and create long-term changes. Another challenge would be limited equipment. Because the patients are at home, you don't have access to the equipment that you would normally have in a PT clinic. So this is where you have to be creative and work with what the patient has access to. They may have some little dumbbells or kettlebells at home, but if not, you'd have to make do with like loading up a backpack with water or canned foods, or loading up a grocery bag to create some type of loading and capacity building in our patients. And instead of using specialized equipment like stretching straps or TRX straps, you would have to problem solve with the patient and figure out what they have access to create the same effect using different tools. I'd venture to say that this is not necessarily worse than being in a traditional brick and mortar clinic, because a huge part of PT is developing a home exercise program that the patient can do at home by themselves. And with video chatting, it almost becomes a more personal experience, because now you can see the patient in the comfort of their homes. And instead of just printing out a list of exercises and say, hey, do these exercises at home, now you can actually see them at home and create changes and tailor the program on the fly. In my opinion, I think education is the biggest thing that we offer to patients. Patients come to see us because they have a perceived problem. They want answers. I think a big part of it is they want to know the reason why they're hurting or why they can't do the things that they want to do. Whether if it's going back to a sport that they like to play or as simple as going up and down safely without feeling off balance. They want answers and they want to know what's going on. And how we achieve that is through education. I'd argue that a big part of what we do as PTs is giving patients the permission to move. It could be a post-op patient, fresh out of surgery, and you're just showing them some type of low-level range of motion exercises to get them moving. Or it could be an advanced athlete who has trouble with getting to that end range position during a snatch. The treatment philosophy is always the same. Do what you can and slowly progress. One of my mentors always said the subjective portion of the evaluation is the most important. And it has become something that I truly believe in. Because just through talking to a patient, you can generally get a great sense of what's going on. Asking about things like mechanism of injury, the duration and the nature of the symptoms, factors that aggravate or alleviate the symptoms, most importantly, finding out about the patient's goals. And with all this information in mind, you can formulate a plan with your patient. And all this could be done online. And keep in mind that these are just some of my own personal thoughts about telehealth. What are your thoughts? And if you like this type of content, like and subscribe, and there's more to come.